Hello, everyone. I'm Kim Graves. This is Jessica Ausbrook, and we are from Solidarity Community Federal Credit Union, and this is the Ripple Effect. She laughs at me. I try something different every time.
She does. She does. We're just trying to find our groove there with our hype music. I think we're getting it, though. I definitely think we're getting it.
You have an amazing guest today. I love her. I haven't
We
seen.
have an
we
amazing
do.
guest today.
I haven't seen her forever.
The lovely Lisa Washington is with us from the
Yeah,
Minority
thank
Health
you.
Coalition of Howard County. We're glad to have you here.
Well, I'm glad to be here.
I'm not sure I've ever actually interviewed you before. I mean, we talk all the time.
We
but
talk a lot.
no bad
Glad
words,
to
Lisa.
see you, Lisa. It's been forever.
It has been a long
Yeah,
time. Yeah. But I see you all over the place. I just don't get close
I'm
enough
like
to
here, there, you know.
That's true.
Sometimes a
Are
billboard.
you avoiding Lisa? I heard she can be kind of scary sometimes.
Oh no, I've worked with her before. Love
Yeah.
working with her.
Yeah.
Oh, we have a lot to talk about. First, let's talk about the coalition.
Okay.
What do you do? What do you provide for Howard County?
So the coalition is tasked with helping with bringing down some of the health disparities in the state. There are about 19 coalitions in the state. I concentrate on Howard County. So we are working with chronic diseases, and we do that through health presentations. We do that also through interventions, and I think we're going to talk about one of the interventions that I do. Also, we do health assessments, so those are free, and we do things like checking blood glucoses, hemoglobin A1Cs, blood pressures, and those are the primary things that we do. I also do some advocacy work where I go down to the state capitol and meet with state reps and state senators, and some of the policy work that we do to make sure that some of the health policy is going
Equitable?
It's equitable.
mean-
Wow.
Equitable and helping us here in Howard County. And we have had some of that because one of the two of the big things that we've worked on are diabetes and maternal and infant mortality. So those have been, the infant and maternal mortality have been one of the things that have impacted us here in this county. We've got one of the highest maternal, or I should say, Indiana has one of the highest maternal mortality rates.
I didn't know that.
We had a young woman who was affiliated with an employer here in the city who recently died shortly after giving birth. And so FSA actually has a subcommittee called Impact, and they do look at infant mortality and maternal mortality. And so those are some things that we look at, and we do go out. I actually have a doll where I talk to women of childbearing age and also family members and people in the community who might come into contact. So we do things like safe sleeping. We teach about safe sleeping. We talk to moms or women who might be thinking about having a baby. What are the ways that you can keep yourself healthy before you have a baby? Because we know that if a mom isn't healthy before she has a baby, the likelihood of being able to have a healthy pregnancy, and we need that mom to be around after she has that baby.
right.
And
Right.
baby needs mom.
Yeah, and baby needs mom. And so we always say we want babies to be able to celebrate their first birthday and beyond. And so those are some of the things we concentrate with on that. So those are the kinds of things that I do.
Is that it?
I mean, really, that's
Yeah.
that's not enough.
It's hard work.
Obviously.
So
Oh
I've
my
been a nurse.
gosh.
I've been a nurse for over 30 years, and I've done things like, obviously I've been a bedside nurse, I've been a case management nurse, I've been a nurse manager, and so doing those three roles has kind of led me into this. And I say it. I don't want to say it's a cush job, but I say it's a job that gets me to do the things that sometimes when you're a bedside nurse, you don't get to do a lot
Sure.
with education, and you'd like to put a lot more time into it. And so this allows me to be able to put more time in with people because we know sometimes, as much as a bedside nurse would like to be able to spend an hour or two teaching someone about diabetes, teaching someone, we do a lot with heart disease, I should also say. So teaching someone a lot more about risk factors for heart disease. What does a heart attack feel like? What do you need to do to keep your blood pressure down? Those are things that I can do and concentrate on now.
We kind of have an idea if we are having a heart attack, but our blood pressure, if that's high, we wouldn't know. If you don't know, you wouldn't know.
Absolutely.
There's lots of things that people are dealing with that maybe don't make them feel good that you can help with.
Right.
Yeah.
Yeah. So like, simple things like sodium, like what foods have sodium in them. And why shouldn't I have more than 1,500 milligrams of sodium? Why does that doctor keep, every time I walk into the office, why is my blood pressure 160 over 100? Oh, that cheeseburger and French fries, that's got over 1,600 milligrams of sodium in it. Oh, in one setting? Yep.
Salt and sugar, man. They're so bad for us.
I
They're
mean,
so
your blood
good.
pressure can do so many different things to you, and I mean, it can definitely elevate to the point where it can create so many different issues in your body. So,
Yeah.
I mean, speaking from a true.
You show us your scar.
Yeah, I can show you my scar. I can show you my scar. So, a little confession point here, but I was one person that did carry high blood pressure for quite some time.
Right.
And in turn, what it created was an aortic aneurysm. And look at her face.
Big deal, huh?
That's a
she
big
went,
deal.
They cracked you
"Oh."
open, didn't they?
Yeah. So, I mean, they cracked me open on all the way down the middle, split me open. And then I ended up getting a mesh implant to repair that.
Yeah.
They cut out part of my aorta. It was a pretty big deal.
That's a very big deal.
Yeah. And it was over 5.2. So look at her face. I'm
I don't
like,
even know what
yeah.
that means.
And I mean, it was very realistic when they told you. I mean, when the doctor looked at me and said, it's like a blister on your finger and it's blistering out. And if it pops,
You're going to die.
You're going to die.
I mean-
and I mean, that's the bottom line. So there's a lot of things that affect this. Number one, your salt intake. Number two, I mean, you have to have a great heart. And at that point, I was probably doing a lot of things that I shouldn't have been doing.
Right.
So your health plays a big part of that.
Right.
So that happened in 2015, and I have one more appointment, and then I should be good.
I'm always
After
amazed,
that,
because I always feel like when people have their heart cracked or their chest cracked open,
Yeah.
that they don't always come back as chipper and as happy as you have. So that's pretty special.
It's like it was an amazing process because most people with a 5.2 aneurysm do not respond the way that I've been able. I've just been blessed, that respond the way that I did. And most people don't make it as long because I went from March all the way to October with the size of that aneurysm.
Oh, wow.
And so it went that long before they actually removed it.
Did you know? I mean,
I knew the whole entire time that I had it.
how did you find out that you had it?
Oh, it was crazy. I went to the doctor because I wasn't feeling well, and they said, well, it's probably your blood pressure meds. So let's take a look at it. But in the meantime, let's do a stress test. So I went and I did the stress test. And while I was at the hospital, while I was doing the stress test, they were doing an echocardiogram. And while they were doing that, they went, whoa.
Ruh-roh.
They just kind of stood back. And I said, and this is kind of funny now, but it wasn't funny then. I said, can you guys kind of hurry up? I'm on my lunch hour. I got to get back to work. Swear I said that.
You're not going
I
nowhere.
said, I got to get back to work.
Well-
And they said, well, guess what? You're not going back to work. And I said, this is serious. And they said, yes, this is very serious. However, we need you to go do a CAT scan right now. And we're going to have somebody walk you over there. And I said,
They made you walk?
I walked here. And they said, we're going to have somebody walk you over there. Yeah, they made me walk over there. And it's like, we'll have somebody hold you and take you over there. I'm like, I'm fine. So I walked back. I mean, after I did that. And then they said, okay, we're still going to have you get on the treadmill, but never told me what was wrong. So I go ahead and I get on the treadmill and I do the test. And afterwards, I thought about all this and I thought, what if it ruptured while I was on the treadmill?
Well, you're at the hospital, so
Wouldn't have mattered at that point.
I don't
You
know
what
how
I
that
mean?
works.
Yeah. So you just don't think about, your everyday lifestyle, how that affected that until you sit down and you talk to the specialist. And I went to Cleveland Clinic because that's where, at that time, because I had I have a bicuspid valve also. So they sent me to Cleveland Clinic. And when they open you up, it's not a little process.
No.
I mean, just the whole entire thing, took a while. But when they do that, they stress to the fact you have to eat well. I mean, the hospital didn't even have a Coke. I was like telling my family, see that hot dog stand out there on the corner? Go get me a Coke.
No.
Like,
They didn't either, did
yeah,
they?
you can't have a Coke.
No
I'm just telling you.
No
you can't have
caffeine
Coke.
on, usually no caffeine on cardiac floors.
Yeah.
Oh,
no, the whole
man.
entire campus
Yeah.
had no
no
Coke.
Oh, yeah.
okay.
You couldn't, anything that you wanted was all healthy food,
Yeah.
even in their cafeteria. It was all healthy food. So you had to have something that was in your diet or you didn't get anything. I mean, you just did without. Of course, I wasn't going to do without food. I was ready to eat.
Can I ask you a question, Kim?
Yeah,
Did you have a primary care physician?
I did.
Did you go to see them first?
Yes.
Okay, so that leads me to my next question for
There you
Lisa.
go.
Not everybody has a primary care physician. And what happens if someone's not feeling good like Kim did? What do they do?
So I'll tell you, that's the one thing we find that we are really struggling with here in this community. I came here 25 years ago. My husband had been here a few years before then. And when he came, there was a large number of physicians who had come to Kokomo. Since that time, I take a guess, there were 20 or 30 physicians who had come in with him. Since that time, I think now maybe about 4 or 5 of them are left here. My husband and I are in our late 50s, and so there is a real shortage of primary care physicians here in this town. And so that is one thing that we really are struggling with.
Yeah, you have to see your primary first.
And we do need to think about how are we going to get care for people, because everyone needs a primary care physician or practitioner of medicine. We do have nurse practitioners and PAs that people can go to. We have, I talked a little bit about maternal mortality and infant mortality. We do have a significant number of women who are going out of county to deliver. We do.
Okay.
That's interesting.
Yeah, it is interesting
It
to
is.
me too.
Now, I'm not saying that we don't have OBs here. We do. But we do have community is building. It's no secret that community is building a hospital in Westfield. And I do believe that Ascension also may be doing something. So we really do have to think about how people are going to be getting health.
When people start going to Westfield for hospital visits, like what's going to happen to our hospitals here and the rest of us who aren't going that way for our
Well,
healthcare?
I think that's something as a community we do have to think about.
we have so much to think about,
Yeah.
man.
Yeah.
I'll tell you another focus that I didn't talk about was mental health. We have a shortage of mental health providers in this community. And I mean,
There's a
that's
shortage of everything.
We need that desperately.
we need it desperately.
Yeah.
So how do folks come to see you? Are they referred? Is it?
So we do have, there's certain places that I do health presentations at routinely every month. I am located in Family Services Association. I have a website, and I will give you my phone number. and that is 765-252-3818. They are welcome to call me there. I can see people individually. So I think we're going to talk about the diabetes program a little bit. I do see people individually. Physicians can refer patients to me if they would like. And then, of course, there is the Food is Medicine program.
Yeah, let's talk about that.
And yeah, so that's basically pretty much how people come to me. I am partnering with a lot of other nonprofits to do programs. So the summer is a very busy time. So when we're out with at all of the health fairs and programs, that's another way in which people can make contact with me. I do want to say that Indiana Minority Health Coalition all got started back in the 80s by two state legislators, Bill Mays and Bill Crawford, who saw the disparities, and they got that started by a legislative action. So that's how Indiana Minority Health Coalition got to be. And I always like to tell people, Minority Health Alliance of Howard County, we see everyone. I know it says minority in the tag, but I see absolutely everyone. So, yeah, I see everyone.
Okay. And everybody needs a little help, and diabetes is
Oh, yeah.
rampant. I
Right.
mean, people have it. Even if you outside looking in, you're like, there's no way that person's tall and skinny and they couldn't be diabetic.
That's absolutely
I mean,
right.
there's nothing that maybe your diet, maybe it's just risk factors or genetics. I mean,
Right.
you got to eat right.
Right.
You do.
To feel right.
Right. So we know that somewhere between 30 and 40 million people right now are actually diagnosed as diabetic. Somewhere upwards of 90 million people are pre-diabetic.
Wow.
We have somewhere between 8 and 9 million people walking around, and I'm talking about in the United States, are diabetic and they don't know it.
I was going to say how many didn't know it.
Yeah.
So there's 8 to 9.
Yeah.
Wow. That's a lot.
About 12% of Indiana are diabetics.
Wow.
So those are pretty staggering numbers. Risk factors. So, you said someone tall,
Yeah.
looks pretty lean, doesn't really matter. There are risk factors such as, once we be over the age of 45, we know our risk goes up. If you have a family member, we can't change genetics. And that's usually a first line relative, like mom, dad, brother, sister. We know, obesity. We do know that is a risk factor that people have. I don't know if I said cardiovascular. So if you have high blood pressure, that is a risk factor. The risk factors just kind of start piling up. The one risk factor I'll say that is kind of alarming. Well, not kind of. It is alarming. We are seeing young people, youth, being diagnosed.
Type 2.
As type 2. And the reason we know that is happening, probably from when some of us were young, we had gym in class, gym in school. We went outside and we played. The American Heart Association says that everyone should have about 150 minutes of exercise a week. Sometimes I get tongue-tied and I say a day, and people look at me like their eyes get really wide. And trust me, my husband would tell his patients 150 minutes a day, but it's 150 minutes a week. What we know is happening because of the advent of phones and video games. Kids are staying in the house, playing video games. And I remember moving when my husband and I were engaged back in 2000, and I drove into Kokomo. I was like, oh my gosh, this place has every fast food place known.
We're getting more.
And I was like, McDonald's? How many McDonald's does one city need? Burger King. I was like, so, and I think all parents might be, and I'll say that, my husband and I did that too. When you're both parents are busy and working,
Right.
you sometimes do that. Let me get something
Convenience.
quick,
Yep.
convenience.
Yep.
I'm tired. I don't want to cook.
I'm tired, don't want to cook.
know.
But we know we need to make sure that we build healthy eating habits with kids when they're young. And so that's one of the things that we know we need to do, not have so much fast food, because those fast foods are just chalked with carbs.
Oh yeah.
And so one of the things that we teach people is we want them to eat 3 meals a day, breakfast, lunch, and dinner, and have anywhere from 45 to 60 carbs with those. And so it's label reading. And I'll tell you, when I first started doing this class and I started looking at labels myself, I was like, oh my gosh, I had to go clean out my whole refrigerator and freezer and get rid of a whole bunch of stuff, because I was like, that has how many carbs in it?
Or
Can't eat that.
you can't pronounce the name of the ingredient. You're like, what is that? Why is that in there?
Yeah.
What's that
I
for?
hate to throw all that stuff away. I might just eat it and be done and
Well,
not
then
buy
don't
more.
buy more.
Yeah, don't
Yeah.
buy more.
So-
oh my gosh.
And we say 2 healthy snacks. And then, the other thing I think that sometimes we don't think about is what we drink.
Yeah.
Oh, sure.
And so take a look at a Coke can. The next time you have a Coke, you'll find out that your Coke is your carb
Yeah.
content for that meal. And so we teach kind of like balance.
Yeah, moderation. Right?
Moderation. So the class that that I'm doing, and we're right in the middle of it right now. Actually, it's going on right now. And it just happened to not be my week to teach. So yay. Allison Allison from Purdue Extension
Oh,
is
yes.
teaching today. And so we called it Food is Medicine. I am certified through the University of Chicago to do a program that Indiana Minority Health had been doing for a while. And it's called DEEP, Diabetic Education Empowerment Program. And it's usually about a 6 to 8 week program. So Allison took her diabetes program, and I took my program. We put those 2 programs together, came up with an 8-week program. She teaches the nutrition portion of it through Purdue, which is phenomenal. She teaches how to prepare a item each week. The participants get some either produce or what I say is shelf stable food, and we are taking diabetics and pre-diabetics. Sometimes those are people who might have, if you don't know, we live in a food desert here in Kokomo. So we are looking for people who might not have easy access to food. And Allison teaches that part of it. It teaches them how to make that food. Each week they go home with the ingredients to make that. And I do I think 5 classes on the actual medical part of diabetes. We employ I was trying to think, it'll come to me in a second.
Okay.
But anyway, a professional trainer, a personal trainer.
Okay. Oh,
And we
yeah.
do, he shows them some exercises they can do so that they also get that part of it. So we teach what is diabetes, what do your numbers mean, how can all of this, we fit everything all together there. So this is, I believe, our 3rd or 4th session that we're doing. And we also work with the health department, Jennifer Sexton and her team. We get numbers before they start. So we get their A1C, their glucose, their cholesterol, and their blood pressure. We get that before the program starts. And then we do it at the end of the 8 weeks. And then we pull people back together. I think we've done it at 3 months and 6 months. And Allison comes up with usually some type of food, and we bring them back, ask them what kinds of questions they have. We do some more numbers on them and see where they're falling. So it's a wonderful program. And I'm glad that we've gotten to partner up and to do that.
You know, when you were saying, you mentioned Allison from the extension office, and I learned about health because my mom's a nurse. And I learned about cooking healthy food because one, my mom's a nurse. Two, I was in 4-H, and not everybody has direct access to all of these things. I know that's where I learned it. Not everybody learns those things.
Right.
Or they learn them at a later age. You're like, well, I didn't know that. There's some things I'm still learning.
Yeah.
Yeah.
I always love to cook different things, try different things. I mean, yeah.
Yeah, and she gives them, they get these recipes each week. And so it's like they go home with the recipes, and there's a binder that they get that has all the things, the slides that I teach.
Right.
So it's a really nice program. Let me say this, it's free.
Is that when we can just be like, hey, Lisa, when does this start?
Yeah,
It's free.
That's
free.
super nice.
it's free.
It's only 8 weeks. How long's the class? How many classes?
There are 8 classes. We say it's 2 hours, but it's probably really an hour and 15 hour. We just say 2 hours just so people know to take. And we've done it at different time periods. So like this one is 11:30 to 1:30. We've had ones that have been in the evenings, and we try to put them in locations so that if someone needs to take the trolley, they can do the trolley. And so we try to make it so that people don't have transportation issues. We did do one of those where if people didn't have, it was one that was a little later. We did team up with CAM, and CAM provided helped us provide transportation with them. The other thing we do put some resources in there, like where the pantries are. So that
Great idea.
they have resources and they know where things are. So again, it's really about trying to help people in the community know what resources out there are. Like we were talking, I was there right before I came here today. One lady had asked, she had to buy a meter because her meter had gone out, and she said she had to pay $75 for her strips, which is that's
a lot.
That's a lot.
Yeah.
Right.
But there is a place in town where people can buy a meter for a penny.
Really?
And yes, and you can get strips. You can get 100 strips for about $20.
That's great.
No idea.
So those are the kinds of things that we like to try to pass on to people, because we know how expensive health care can be for people. And when we talk about diabetes is a very expensive disease. We know that, it is one of those things. If you have diabetes, sometimes people have problems with their blood sugars being too high, being too low, and so it can make them non-productive. And so those are the unheard of costs in diabetes, where people can't show up. Or if they go to work, if they have one of those events. I always like to point out people who have hypoglycemia, steel magnolias. There's a scene. There's a scene in there where Julia Roberts is going to. She's getting ready for her wedding, and she has that moment where her blood sugar drops, and her mom knows what happens, because yes, those are kinds of things that make people not productive at the time when they have those highs and those lows. And so those are the kinds of things that we like to teach people about.
Well, and it's not easy to learn how to maintain it, I don't think.
No.
I mean, you got to learn how to manage diabetes before you can get anywhere with it. Is it medicine? Is it diet and exercise?
Right.
That's what we got to find out.
Right.
Yeah.
And
It's all of those things, I bet.
Yeah,
but-
Jennifer Sexton said today, she said, how many of you feel like you have taken on a second job with your managing your disease? And that's a perfect,
That's a true statement.
a true statement. True statement.
Yeah, that is a true statement. Anybody that I have known in which diabetes runs in my family, I mean, it is constantly they're pricking their finger or giving themselves an injection or just constantly checking all the time.
Well,
So
technology's gotten really great too. Like my sister, she's type 1, my sister is, and she has a thing.
oh yeah, I noticed those.
Yeah.
Yep. I'm not quite sure what it's called, but I know it's
CGM.
Yep. Continually keeps her.
Continuous glucose monitoring.
Yep.
Yeah, we were talking about that today. And then, we do talk about some of the complications that diabetics can get. For instance, diabetics sometimes have a higher risk to go with their kidneys, and so dialysis. So,
Oh.
I don't think I knew that.
one of
I
the
didn't know that.
one of the things sometimes is that people, I'm not going to say it's a good thing, but when I was a floor nurse, everyone who was in kidney failure, you had to go in to be dialyzed. There are people who are taught to dialyze at home. Now,
Oh, wow.
that was never thought, that was an unheard of thing when I was a floor nurse. But people who do have to go in for dialysis, that's 3 days a week. So most people will tell you the day you go in, you're drained. It takes you a whole day to get over it, and you're going right back the next day, and
All the time.
all the time. So it alters your life the whole time. So that's one of the reasons that we really like to, teach about complications and teach about, it's just not knowing your glucose numbers. It's knowing your kidney numbers. It's about knowing your cholesterol. It's about knowing all of your numbers. So that's the important thing about diabetes. So I do, as part of my job, I do put a lot of time into diabetes management.
Yep.
Wow. It's a big deal.
It is a big deal, and it affects a lot of people.
So when I say I have a cush job, it's not a cush job, but it's taking all the things that I've learned throughout my nursing career and being able, I think, to use them in a wonderful way to educate. And there are certain careers that you know that career is for you. So I've always known that nursing was the career for me. And it's a passion that I have. And I took care of a lot of diabetic patients. I took care of a lot of people who had to have amputations. And we know that if people know their numbers and follow the numbers, we can decrease that percentage of people who don't have to have something amputated.
Sure.
And we want to decrease the complication rates as much as we can. So that's why I love what I do.
Mm-hmm. Now, if people want more information or if they want to get a hold of you at the Minority Health Coalition of Howard County, what's the best way for us to reach out? Where do we find you?
They can call me at 765-252-3818, or they can email me at washingtonl288@att.net.
And Kim and I both know how to get a hold of Lisa, too. So
Yes.
if you see us.
I still think I have her on
Connect.
speed dial. Actually, I was going through my phone the other day, and I'm like, oh, Lisa's still in there because I remember.
Yeah.
I do. I still think I have you on my phone. So
And they're likely to see me at all kinds of meetings.
Everywhere.
I'm everywhere.
thank you for all you
love it.
do.
Well,
We
thank you.
appreciate
I
so
appreciate you
much.
too.
Oh my gosh, so good to see you.
Thanks for coming in, Lisa.
Thank you.
That'll
You too.
wrap it up for the
Thank
Ripple
you.
Effect today. I'm Jessica Ausbrook. This is Kim Graves. We're from Solidarity Community Federal Credit Union. Thanks for watching.